If you've followed me for a while now, you know I often talk about women's health, hormones, and strength training. But my work has always been about longevity and metabolic health for both men and women. Today, we're shifting focus and talking about testosterone. It's a topic many men hesitate to bring up. It can feel uncomfortable and sometimes even taboo, but it shouldn't be. Testosterone is a hormone. It's part of normal physiology, and it plays a meaningful role in energy, muscle mass, metabolic health, sexual health, bone density, and overall well-being. When we avoid the conversation, we miss out on opportunities to address real health concerns. Hi, if you're new here, my name is Dr. Esra Shermadou. I'm a board-certified family medicine and obesity medicine physician, and I'm the founder of Sakina Health, where I help adults improve their metabolic health and optimize their hormones so they can age with strength, confidence, and independence. Over the past several years, I've been seeing more and more men asking about testosterone, often still hesitantly though. Many worry they'll be dismissed or brushed off. And to be honest, the discomfort can sometimes be bidirectional between patients and healthcare providers. Hormones are often under-discussed in routine medical visits, not because they're not important, but because they're rarely the immediate cause of life-threatening disease. Appointments tend to focus on diabetes, cardiovascular disease, blood pressure, and other chronic conditions, which are, of course, critical, but hormones influence many of those same systems. Some men come in knowing they don't feel like themselves. Others aren't sure whether what they're experiencing is hormonal, stress-related, metabolic, or simply aging. And part of the confusion is that there isn't a universal definition of low testosterone. Different labs use different reference ranges, different medical organizations use different cutoff values, even international standards vary. So a man may have his testosterone checked, be told it's normal, and still feel unwell. But that doesn't mean his symptoms aren't real or that he doesn't qualify for testosterone replacement. It means a number alone doesn't tell the whole story, especially when there's no clear consensus on what normal is. Furthermore, it's the free testosterone that we really need to focus on, because proteins like sex hormone binding globulin affect how much testosterone is actually available to tissues. We also consider age, body composition, sleep, stress levels, metabolic health, and fertility goals. Testosterone therapy isn't a casual medication. It's typically a long-term, lifelong medication. You can certainly come off of it, but you will return to feeling like how you felt before you started. Coming off of it can be difficult and unpleasant. Therapy also requires ongoing lab monitoring, and it can suppress sperm production, which is critical to discuss if fertility is a goal. At the same time, lifestyle absolutely matters too. We know that reducing excess body fat can significantly improve testosterone levels. We see this in men who've undergone bariatric surgery and those who have lost with diet and exercise. Studies show that a 10% reduction in body weight increases testosterone levels by about 85 nanograms per deciliter. Weight loss of 15% can increase testosterone levels by 250 nanograms per deciliter, which is very significant. Sleep apnea, resistance training, and stress management also play a role, but they require consistency, of course. For some men, lifestyle changes alone are enough. For others, testosterone therapy and lifestyle optimization may work together. Sometimes starting testosterone can give you the motivation to start going to the gym and make other lifestyle changes. So the two can go hand in hand. The key to all of this, however, is thoughtful evaluation, discussing the risks and benefits before starting treatment if it's appropriate. Because the real question isn't simply, is my testosterone low? A better question is, how much are my testosterone levels contributing to the symptoms I'm experiencing? It's rarely just testosterone in isolation. And from what I've seen clinically, it's usually testosterone plus lifestyle. So this includes body composition, sleep quality, especially the later half of your sleep, stress levels, metabolic health, and training patterns. Testosterone therapy may improve energy and motivation for some men, which can make lifestyle changes more achievable. But it is not a substitute for those changes. And while it can have profound positive effects, unfortunately, testosterone alone isn't a magic pill. You can't start testosterone and expect it to solve every issue or suddenly make you feel completely optimized without addressing those fundamentals. So, what does responsible testosterone care actually look like? It starts before any lab is drawn. It starts with a conversation. What symptoms are you having? What concerns brought you in to begin with? What are your health goals? What are your life goals? Do you want to preserve strength as you age? Do you want to maintain independence? Do you want to stay active with your children or your grandchildren? Your long-term vision matters. Fertility matters. After that conversation, we evaluate labs. not just total testosterone, but free testosterone, sex hormone binding globulin, estrogen levels, red blood cell count, cholesterol levels, and other markers that give us a broader picture of your health. And it's important to mention estrogen here really quick. Many men assume that estrogen levels should always be suppressed, but estrogen plays an important role in men, including in libido, bone health, and cardiovascular health. Automatically blocking estrogen without indication can create new problems. Not everyone on testosterone needs an estrogen blocker. Care must be individualized. Once labs return, we look at the full picture, not just your numbers, but your symptoms, and your goals. For some men, testosterone therapy may be appropriate. For others, alternative approaches that support your body's own natural testosterone production may be considered. And for many, lifestyle optimization remains foundational. These cannot be ignored. People are often looking for shortcuts or aggressive protocols, and I get it. When we have a problem or don't feel well, we want it fixed right away. But foundational health cannot be bypassed. Responsible care is not putting everyone on the same protocol. It's about personalized, monitored long-term management. And that takes time and thoughtful discussions. If this sounds like the care that you've been looking for, then check out my practice, Sakina Health, and book a consultation call today. As always, my goal is simple: to help both men and women understand their bodies better so we can make informed decisions and live strong, healthy lives for as long as possible. If you found this video helpful, make sure that you like and subscribe and share this with a friend who needs to hear this. Bye for now.